So I welcome Dr. Asavari Manvikar ma'am. Ma'am is MD Kaya Chikitsa from University of Pune, India. And she's a gold medalist from the Institute of Indian Medicine in 2001. And she's founder and lead faculty for Minnesota Institute of Ayurveda. At present, she has established and lead one of the premier Ayurveda education center. And she is practicing Ayurveda at present, and she has also running a center for spirituality and healing in University of Minnesota. She teaches graduate level courses in Ayurveda and integrative health, physical as well as an online mode. She has also collaborative interdisciplinary team to promote the holistic health education. She is a faculty member of Ayurveda medicine of a BSDT Ayurveda College, Pune, in India, during the 2001 to 2003. And she is also expert yoga teacher as well as trainer. She has 15 years teaching advanced yoga and leading teaching training program at Yoga Center, Retreat and Green Lotus Yoga. She is also community educator for various regular workshops and public talks. She is currently adjunct faculty at Normanville Community College offering certificate programs in Ayurveda. She is also president of Manchester Ayurveda Association. She is the state director, Association of Ayurvedic Professionals in North America, that is APNA. And she is also committee member of Beta Ayurvedic Doctor Program, that is NAMA. She is a chair for Global Webinar Research Series Project Council of Ayurveda Research. She is editorial board member of International Journal of Research in Ayurveda and Allied Sciences run by PD Ayurveda College. She is also advisory board member of Hindu Community Center. She has several national and international peer review paper on her credit. She is also a frequent speaker at global conferences, webinar on Ayurveda, yoga and holistic wellness. So I really welcome Dr. Asari ma'am for these sessions, and I request for your concluding remark as well as chairperson remark. Before that, if any question from the participant, we can take. I think a very nice presentation by Dr. Ujjwala ma'am also, and all other our guest speaker like Angelica, Mariana, and Dr. Piri also in the afternoon session. So I really would like to express my gratitude for all joining guest speaker for this international conference on globalization of Ayurveda on behalf of my college, Jupiter Ayurvedic Medical College, and I am a principal, Dr. S.K. Danga, to represent my college here. So it was a good experience and response from all the participants throughout India as well as overseas. So now I request Dr. Asari ma'am to conclude with her chairperson remark as well as concluding remark. Over to you, ma'am.
Thank you so much. Thank you so much for wonderful introduction. And it has been a wonderful conference today. Good morning, good evening, everybody. I'm joining from Minnesota, and there is a small slideshow, so I would like to go through it. Just give me 1 second. Yeah, so I would like to talk a little bit about Ayurveda in global public health and the integration of ancient wisdom with modern healthcare. So before I start, I would like to say a little bit about my journey. My all education was in Pune at Tirak Ayurved Mahavidyalaya, and then I came to St. Louis, Missouri. So before coming to the US, I was teaching at BSDT, Bharatiya Sanskriti Darshan Trust. I was also involved into Cancer Research Center. And when I came here in the US in 2003, what I noticed that the awareness was really missing. People did not know about Ayurveda at all. People did not know how to pronounce the word. And that's how it became my mission to bring Ayurveda to the forefront and definitely increase the awareness. Then I came to Minneapolis, Minnesota in 2005. So up until now, so last almost 25 years, I'm here in Minnesota. I have seen there is a change, definitely. There is a, because of the globalization, there is huge demand as well as Ayurveda, as we know, can do wonders. And there is definitely a lot of need, but it is happening gradually. So I developed programs and I started teaching at Center for Spirituality and Healing at Minnesota university. I started having my own practice, IU Wellness, and seeing a lot of clients. And the education again was the most important, thing here in the US. So I decided to have institute, and I created an institute, Minnesota Institute of Ayurveda, and now we run various programs there. So it has been a huge journey, long journey, lot of work, and lot of efforts to bring Ayurveda forefront from the scratch, honestly. But this is how I would like to say a little bit, about my own journey here in the US. And now the things have definitely shifted. They have changed a lot. There are a lot of other organizations, there are a lot of other schools, there are many more practitioners who are coming to the US, and they are trying to develop their practice as well as bring it to the community. So this is a little bit about my school, Minnesota Institute of Ayurveda, and our mission is to promote the authentic education here in the US and as well as globally. And this is a little bit about my practice where I see clients for Panchakarma as well as definitely diet and lifestyle recommendations and healing. So yeah, I would like to talk a little bit about, why Ayurveda matters in the global health. So if we look at the overall picture, where is Ayurveda right now? Where is the need? What is the demand? And what can we do together? See, this is not one person's work. It needs a lot of collaboration. So, finding out the key areas where we can actually bring our strength. So, the key areas of public health relevance as well as the evidence is really important, and the integration into the healthcare system. And definitely, we'll talk a little bit about the future directions. So, when we look at Ayurveda's public health, paradigm, where Ayurveda fits in, so all of us we know that Ayurveda is a holistic health system. It connects body, mind, and spirit, and it is extremely important for the prevention. So, swasthasya swasthya rakshan, that is our first goal. And definitely, if there are any health issues, we use it, the individualized approach to see the clients, to see the patients, and to help them heal. So, lifestyle management, dinacharya, rutucharya, these are extremely important for the prevention, and everybody can do it without much intervention. So again, the awareness is very, very needed, and that is happening at different levels. Here in the US, I would like to talk more about the US because I'm here last 25 years. So if you look at the global challenges, right, in which areas we can actually penetrate or participate and bring our expertise and help people to heal. So if you see the rising burden of non-communicable diseases, right? There are so many diseases which are lifestyle diseases, disorders, and they are rising. So how can we help? By using our intellect, our knowledge, our wisdom, our years of education, as well as years of experience. In the mental health, there is definitely a huge crisis, not just in the US but worldwide. So where can we, help people? Women's health, as Dr. Ujjwala, she just spoke about it. It's such an important aspect. The women as well as the children, how they need, the Ayurveda help, as well as the climate change. And there are so many changes happening currently all over, everywhere in the world, and how the health is getting impacted, and where and how we can bring in our knowledge and help people. And also regarding the the populations where Ayurveda has not reached yet, how to reach there, right? So this is really, I would say, like a bird's eye view. These are all different areas where there is a need, and where we can go and where we can help collectively, collaboratively. So again, these are some facts. So if you look at WHO website, you will find a lot of information about the burden, what things are happening, and how people get having a lot of health problems, challenges, and even deaths because of that. So if you see NCDs, which are the non-communicable diseases, killed at least 43 million people in 2021. And again, this is about 2021. We are in 2025 right now. So 75% of people, they are actually facing a lot of issues. And these are the areas where actually Ayurveda is absolutely very, very helpful. And we can bring in, all our knowledge, and we can help people for cardiovascular diseases. If you look at, these are the four sections where there are a lot of people who are having major issues. So cardiovascular diseases, diabetes, complications of diabetes, chronic respiratory diseases, and cancer. So the numbers are rising every single minute globally. Again, I'm not talking only about one specific area, but this is a global issue where we all should collectively work together and bring in our wisdom and help people. We'll see how we can do that. So again, this is regarding the burden, and we know that the key areas definitely is the diet, because everything goes back to the Trayopastambha, right? So Ahar, Nidra, and Brahmacharya. So how can we convey this information, this knowledge, and its importance in day to day life? See, these things are not when you start getting the health problems or when you start getting the symptoms, but from the beginning. We need to bring this in the community, in the awareness that needs to be shift. So we know that the ahar, the sattvic ahar, like the food combinations and plant-based diet, which is very challenging to find here in the US. Most of the people, they are very high, GMO based foods, as well as like everything is frozen, everything is can-based. It's really hard to find good quality, wholesome food, plant-based food. Most of the times, people eat a lot of meat as well. And there are so many diseases which are contributed because of that. So, how to change, how to make the shift in the thinking process? So, we really need to go a little bit more deeper in this issue. Also, regarding the sleep, I see so many students, at the University of Minnesota as well as in my own institute. The students really are depriving with their sleep. They do not consider sleep is an important factor of the life, and that's how there are a lot of mental health disorders as well, lot of anxiety, there is depression, and there are a lot of other challenges people are facing all the time. So how to bring the dietary lifestyle, regimens, how to bring the detoxification process, how to just understand, right? Like look at as Dr. Ujvala was talking about, uh, like check your breath, check your tongue every day in the morning, in the mirror, something that you can do on your own. So these are some very simple tools and techniques, but people are not aware of those, right? So how to do that, as well as bringing actual, cleansing processes and the importance of it to the global, population is really important. That is the need of the day. Also, the stress management. I mean, there is stress for every single person, whether it is a small kid who is going into the elementary school, till if you look at people who are at the CEO position, every single person has a lot of, stress related to the time, related to the financial situation, related to the changes which are happening globally, on different levels. So how can we help them, right, to heal from that? So some tools like the meditation, pranayama, which they can do on their own, even at home, without really going to and spending, a lot of time and money into it. So this is the, awareness that needs to happen, that needs to globally, shift. So regarding the mental health crisis, if we see, according to WHO, there has been almost 1 billion people who are actually having mental health disorders. So on different levels, right? Some people are having like very mild level generalized anxiety, and some people are really having a lot of depression where they are actually committing suicide. I have seen like so many people, even the kids at a very young age, they are dying because of this situation, because there is loneliness, there is no goal to the life, they don't know how to live. The daily routine honestly really helps us to keep with the discipline, and there is a goal for the life, right? But these things are, people are not really aware of that. So how to bring all these things in the community post pandemic? I mean, during the pandemic the things changed so much because everybody had to study or do all the work from home. So the communication gap was huge, and after that there is a huge rise in anxiety and depression, almost 25%, and it's honestly everywhere. So how we can help people to build that mind body connection, using our paradigm, using sattva based model, and how to bring it to every single person, how to make this as a household, like how to bring Ayurveda in every household. How to get rid of the emotional toxins, right? Because they are so deep rooted, there is so much PTSD, lot of trauma that I see like every day, and in and out in my practice, and how to heal from that, right? So these are some areas where Ayurveda can really help a lot, and these are the areas where there are a lot of challenges right now. We definitely can use like a lot of herbal remedies, Satvavajaya Chikitsa, which is really fascinating and very important. Along with that, we can do some Panchakarma treatments, Shirodhara, Abhyanga. We can ask people to do it on their own. So they can do their Marma massage, they can do regular Abhyanga on a day-to-day basis, as well as like yoga, meditation, pranayam. It has huge impact. And I what I really feel is the necessity of awareness, because people are not aware of these beautiful tools which are out there for more than 5000 years. I'm honestly like, you cannot really go back and say exactly how many years. That's old, and that's ancient, and that's beautiful, our science is. In the women's health, I see there are so many complex issues. So regarding the childbirth, as well as higher cost, and so people are not really getting the healthcare services as they need. They do not know what kind of food is good for them, during the pregnancy, as well as they wait a lot. Like most of the times, women wait a lot because of the career to become pregnant, as well as there is no awareness about how to take rest, even during the pregnancy, after the delivery, how to take care of the baby. There is absolutely no awareness. The second day they start walking out of the home immediately after the childbirth, and uh, do not follow any regimen at all regarding the diet as well as the lifestyle. And then after that, they start facing so many health issues on a larger scale, going forward, and they do not know where the cause is. So again, it's really important to make them aware what needs to be done. And regarding the breast cancer as well as the cervical cancer, there are so many cases which are rising again, so where Ayurveda can definitely help is explaining regarding the menstrual health before any health issues, they start popping up, from, from even childhood, from menarche. The girls need to know about these things, because the life is so competitive. Everybody wants to go and to do all the sports even during the menstruation, right? So how to take care of that? What is the care, what needs you need to avoid during that time, so that it will not go to the extent where you will need in the future as IVF, right? So, how to take care during the pregnancy, how to take care after, menopause, during the menopause, the support, right? So with the herbs as well as with the emotional care, with the fluctuation, with so many hormonal changes a woman goes through, how not just Ayurveda but also the community can help a woman to go through it. Also regarding the cancer, honestly, like I see so many clients every single day. The numbers are rising very very quickly, because of many factors, honestly. Like there is a lot of stress, the food is not good, as well as people are not aware that they need to take rest and also do the cleansing processes as needed. So how to integrate, right? How to integrate Ayurveda along with other systems which are available, which are in the mainstream wherever we are practicing, because this is global health issue. For the children, or for the kids' health, again, how to improve the immunity. There are few simple things the moms can do, as well as both the parents actually they can do, is like looking at their food, what they are eating every day. If you have a cold drink, you can do like cold water, boil it and then give it to your babies as they are growing. Making sure that they are taking like good quality milk and milk products. Again, regarding the milk, people do not drink cow milk. There is just no awareness at all. There is a lot of fear actually. Forget about awareness. I see there is a lot of fear based situation. People every time feel like, oh, if I eat this, what will happen to me? If I drink milk, I might start getting hormonal issues, and I should completely avoid that. And there are a lot of food allergies as well, because there are so many toxins built up in their bodies over a period of time, right? So how to explain them and how to help them to reduce those allergies what they are going through, how to let them know what are the good dietary recommendations or changes they need to do. If you go to cafeteria in the schools, um, honestly the picture is so bad, and the kids are growing like eating these foods day in and out every single day, because the parents are working, the kids go to the school, they eat food there and in the cafeteria. If you look at the food combinations, they are really really bad. I mean, they eat like a lot of meat. Along with that, there is strawberry milk, like there are like different milkshakes. The food is very very cold, in the cold areas, right? So there is a lot of viruddhashan that is happening every single day. And at some point, their system breaks down. There is so much ama that is created in the body, and then ultimately they start facing a lot of allergies, food allergies. They have to stop eating foods. Same thing is regarding the gluten. Whether people are having allergies or not, they stop eating gluten based product completely. So how can they get nutrition? Where can they get nutrition from? So that is the biggest challenge right now. How to create healthy habits, and how to manage overall your anxiety, your stress, how to create those good routines for sleep. So there are so many different areas where the kids really need a lot of education, and I feel like it's important to bring Ayurveda from the elementary, or at least from the middle school, because that is the growing age, right? So once you develop all these good skills at that time, you can grow with those things and then you continue those practices even in the future. Regarding a lot of infectious diseases, viral, there is so much viral load and there is so much immunization. So before thinking about, immunization, try to build your own ojas, try to look at your immunity, try to look at so many beautiful rasayana practices. Try to add some foods which can be helpful to, improve all your tissue health, right? So in order to have that immunity going, so that you can face all these viral as well as bacterial infections which are out there. So there is a lot of awareness, or there is a lot of load related to the immunization, but I feel like it's important to use Ayurveda before you get to that point. So having like even holy basil. So there are so many herbs as well as spices which are easily available. There are local spices as well. So for example, mint, rosemary, these are the very easily available spices. The ginger, it's all over. Turmeric, all over. Everywhere you can find it, no matter which city or which area you go to. So these are beautiful spices, having lot of strength, and they can help improve our agni, reduce the ama, as well as improve the dhatu bala. But again, the awareness is missing here, right? So we need to bring this to every single person, every single household. So there is this WHO recognition to Ayurveda, which is amazing. There is a lot of recognition Ayurveda getting because of honestly, because of lot of work and effort and collaboration, and Ayush support is very, very, very important. And things have changed last few years. There is no doubt about it. But besides that, I feel the standardization, the regulation, and most importantly, in the country like USA, the insurance coverage is very, very important, because Ayurveda currently is not licensed, it is not covered by insurance. And if you want to use Ayurveda for, for general public, for everybody, it's really important to get it covered by insurance companies, because people pay very hefty premiums in order to get insurance, and only the mainstream is covered by the insurance. And that's how, even if there is huge need, people cannot use Ayurveda in their day-to-day practice. So, what are the future directions? What are the future areas where we can collaborate, right? So, the conferences like today's conference, the international conference, to know what things are happening at different level regarding Ayurveda, regarding its awareness, regarding its use in day-to-day practice, as well as at the research level, as well as at the study, right? Bringing awareness through the education. So all that is very, very needed. So these collaborations need to happen more and more often, as well as the licensing, the support. If Ayush can help to support for the licensing, not just in the USA but also in other countries, so that Ayurveda can become accepted and more regularized in other countries also, and people can practice it on a larger scale, right? So it needs to come in the policies. So the policy makers really need to think about it, as well as collaborate and work heavily on it. Again, I feel like that is one of the missing thread here. So we know that Ayurveda is a beautiful preventative science, beautiful healthcare system. We all love it and we all believe into it. We all practice it for ourselves, as well as we try to bring it to general population as much as we can, because of its most preventative, personalized, as well as holistic view. We know that there are so many global challenges on different levels, everywhere. There is a huge demand. There is some awareness that is building on different levels, but again, there is unity that is missing, I feel, because it is happening on different levels, but it needs to be collective effort, not on an individual level, not on a one or two different organization level. It has to happen on a huge level. So it needs to come into the licensing, and also the insurance coverage is very, very important. And this is the path to healthier, happier life. We know that the quantity of life has increased, or the lifespan has increased. People used to die in their 60s, now they live until 80s, even 90s. So definitely there is a huge change that has happened last few years, but the quality of life is totally missing. People are taking so many medications all the time. and there are so many side effects because of those pharmaceuticals and the chemicals. So how we can help them to reduce that load, that burden, and also the stress, physical stress, emotional stress, mental stress, as well as financial stress. How we can help collectively, that's really really important. And how to make this global shift and make people more healthier and aware about their mind body, and learn and these important techniques regarding diet, lifestyle, right? So again, everything comes back to the lifestyle, like dinacharya, rutucharya, because that helps for the prevention. So this was a wonderful conference. Thank you, everybody, for all of your beautiful inputs as well as your presentations. So Angelica, Mariana, Dr. Pairi, as well as Dr. Ujvala, you did absolutely awesome, wonderful presentations. And I'm very thankful and very grateful to the organizers, so the principal, Dr. Danga, as well as Dr. Marda, Dr. Bauni, thank you so much for organizing this beautiful event, and it needs to happen more and more.
Yes,
Thank
thank you,
you.
ma'am. Thank you for your nice presentation and various information about the Ayurveda in your state. So the need of further adaptation by the government from your side. So it was very excellent experience of all participants. Even the feedback also I got that excellent presentation by all the speakers. I really would like to express my deep gratitude, and they have given the very feedback for all the participants as well as the chairpersons. So I really thank you.